And good afternoon. It is time for our regular Friday Lunch and Learn. And today we're going to be talking about the skin. We're going to be talking about why it's important to keep your skin healthy and some things that you can do to help your skin just do better. Now, if you are looking at your body holistically, you're going to know that your skin is your first line of defense for any invader coming into the body. That's why we put a Band-Aid on a cut or a scrape. That's why we use antibacterial creams, antimicrobial creams, and that kind of thing, because we don't want the critters coming into our skin. And so our skin is really, really important to our immune system, but it's also important to a whole lot of other things that I'm going to talk to you about today. I'm also going to talk to you about some specific skin conditions and how we take care of those here at the clinic. So if you know somebody who has skin issues or doesn't understand the importance of taking good care of your skin, then you're going to want to share this. And I do appreciate all of you who do share our things, and it's really helpful for us. Now, your skin, if your skin is pretty, then your insides are pretty good. If your insides are not so happy, if there's a lot of toxicity, if there's some liver congestion, gallbladder congestion, all that kind of thing, then it's going to reflect in your skin. So this is not to, say anything bad about anybody's skin or shame people or anything like that, but you can actually tell the state of your internal organs by the state of your skin. So we're going to just talk about that just a little bit. So your skin is not just a covering, but it plays a diverse role in the body, helping to regulate body temperature and also formulating vitamin D3 production. The skin's absorptive properties, allows it to take things in from the environment, such as beneficial medications, topicals, or not beneficial things that we have in our environment. So whatever you are putting on your skin, your body is going to absorb it. So make sure your cosmetics are clean, make sure your lotions are clean, make sure that you don't have just a whole lot of yuck that's in the products that you put on your skin, because your skin is going to absorb them. Now, studies have found that the skin excretes toxins through the sweat glands, including phthalates, bioaccumulated toxic elements, cadmium and aluminum, and organochlorinated pesticides. The skin even has a secretion function to produce a layer of oil and acid to keep it supple and to protect it from outside invaders. Now, cadmium is a heavy metal that comes from smoking. So if you smoke, if your parents, grandparents smoke, you probably have cadmium in your DNA. And so the skin will help to expel that. We are not encouraging smoking, okay? We don't want to do that. Aluminum, so if you are doing antiperspirants and that kind of thing, then you're probably going to be having some aluminum toxicity issues. And so we want to make sure that those come out, and the skin has the ability to do that. One of the practices that we do here in the clinic is we do dry skin brushing. Dry skin brushing is when you take a vegetable bristle brush, say that 3 times fast, you push it up your skin, your dry skin, toward your heart. And what that will do, it exfoliates the skin, it opens up the pores, it allows the skin to breathe and all that kind of stuff. So if you've got skin issues like eczema, psoriasis, anything like that, then you're going to want to do that. Now, what people have done is they have taken the skin residue from that brush, they've sent it to the lab, and they've analyzed it. And the lab results come back that the sweat in your skin and the exfoliation of your skin has the same constituents as urine. This is why sweats can smell bad, okay? Because you are getting rid of all that toxicity. So we like you to wear antiperspirant, of course, but if you keep your body clean on the inside, you are going to sweat, but you're not going to have an odor problem per se. So take that into consideration when you're thinking about sweat and that kind of thing, okay? So the skin has to have strength and durability, but it also has to be flexible and to be able to repair itself. So if you are someone who has skin wounds and your skin is not able to repair itself, then you know down on the inside you've got some trouble with your immune system, all right? So we don't want to go into all of the different layers of the skin because then I'm going to sound like Charlie Brown's teacher, and I don't want to do that. We don't even need to know that, but what I do want to talk to you about is the keratinocytes. So these are little cells that make up the skin and how they turn over and what they do so that you can know how to take care of your skin. You have new skin every 4 days. Okay, no, sorry, every 4 weeks, every 4 weeks. So if you are working on a skin issue, you're not going to see results in 2 days or 3 days or even 2 to 3 weeks. It may take at least 4 weeks, but usually closer to 8 weeks before we've got the results that we need, okay? So those keratinocytes are stem cells located in the lower epidermis, all right? They get pushed toward the surface of the skin as the new cells underneath them begin to be created, and it pushes those cells up to the skin. As they mature, they produce a lot of keratin and they become packed with this protein, all right? As they are coming to the surface, they get more and more packed together, and this is what makes your skin waterproof. Who knew that, right? And so you've got all these little layers of skin that they form a seal and create a waterproof barrier. You have a new covering of skin every month. So this is a really good thing. Now, we are going to talk about psoriasis in a moment, but we have seen psoriasis absolutely turn around in 8 weeks, which is absolutely phenomenal because people will go to their doctor, they'll want to have something done, and your doctor, your medical doctor is going to say, oh, well, that's just the way it is. There's no cure for that. And so you're going to have it for the rest of your life. Well, we're here to tell you that that's not necessarily so, and we're going to get to that in a moment. You have calluses. Some of us have calluses. You have calluses when there is excessive rubbing of the skin, and so the skin clumps together even more tightly to create a barrier against that friction, all right? So if you have hyperkeratosis, which is what a callus is, it also can give you the eczema, the psoriasis, and other autoimmune disorders, all right? Arsenic poisoning can also be attributable to skin issues. Who knew? So this is one of the things that we do when you come in with skin issues is we look at what is actually going on in the body. Is what we're dealing with a heavy metal toxicity? Is it a gut-brain connection? Is it a fungal pattern? So all of these things are possible, and that's why when people come in, we do the different things that we do. And if you look at our Tuesday testimonials, almost every week it's something about creating that connection between the gut and the brain that just clears up these skin issues. So it's absolutely fabulous. I absolutely love what we do. Now, in the skin also, we have little cells that make up our skin color, and they are called melanocytes, okay? They create melanin. So increased exposure to sunlight results in the melanocytes producing more melanin and causing the skin to become darker. This is another example of how our skin reacts to our environment. Now, what we don't want to do is we do not want to go out in the sun and bake and all that kind of thing, because when we do that, we damage the skin. And we're going to talk about collagen in a moment, because collagen is what makes our skin very supple, the elastin, all that kind of thing. And as we age and as we get out in the sun, and as we eat sugar, we damage the collagen fibers in our skin, and that's when our skin starts to deteriorate. It looks crepey, it can look droopy, and all that kind of thing. So we don't want to do that. Now, vitiligo is a condition where the melanocytes in the skin stop producing melanin, and you have seen that in every color of skin there is. All right, it can happen. It's not just something that happens with dark skin, although it is more noticeable with dark skin, but this is an autoimmune reaction. So how do you correct that? You correct the confusion in the immune system. Now, your doctors are going to say there's no way you can do that, but we know that there are ways, okay? We researched this, and we know that, yes, there is no cure for that. However, if you get your body to function the way your body is supposed to function, then the body will heal itself, because that's how it works. That's just how it works. Drugs are not going to heal you. Supplements are not going to heal you. What they're going to do, supplements are going to get your body in the frequency so that it can heal itself. Now, you've got another set of cells in the body called Langerhans cells. Now, these cells, and this cracked me up when I read this, these cells have a unique shape. They have long dendrite projections like arms that reach way out between the keratinocytes and extend toward the surface of the skin. You can imagine them as little octopuses, okay, that use their long arms to sense what's going on in the tissue around them. The network formed by these cells is dense. Microbes, little tiny cells, germs, protozoan, amoeba, that kind of thing, who are trying to get into the body, will encounter these little octopi that are in your skin, and it stops them from gaining interest into your skin. So I think that's really cool. I did not know that when I was doing this research, okay? So these little cells also can sense the microbial activity, and they quickly initiate antimicrobial responses. The keratinocytes can alert the Langerhans cells to danger by releasing little chemical messengers called cytokines. And you probably have heard about cytokine storm and that kind of thing. So your body will have an immune response, which is an inflammatory response to an invader. And this is good. This means that your immune system is functioning the way it needs to. When we get into trouble, it's when we have chronic inflammation, because chronic inflammation sets up disease process because your body doesn't know what to do with it. That's why we get eczema and psoriasis and vitiligo and all those kind of things that we get. All right. As within any neighborhood, things can go wrong in the skin when communications go awry, and psoriasis is one of those examples. Now, psoriasis, they tell us, is a autoimmune disorder of the skin. They say they don't know the cause of it, okay, but what they do know is that it is a T lymphocyte in the epidermis are triggered to become overactive and start signaling uncontrollably. When the T lymphocytes start releasing excessive amounts of cytokines, it initiates an inflammatory response in the skin. Now, I will just tell you that we have a lot of people that come into the clinic with psoriasis, and I believe, not a doctor, this is not a diagnosis, this is just from my research, psoriasis is a fungal pattern. When you deal with the gut, when you get the gut doing what the gut needs to do, you get rid of all the extra fungal patterns, that's yeast, candida, different things like that, then the skin just clears up because it doesn't have to deal with that. Now, what causes fungal patterns? Well, toxicity in the food that we eat, but there's this thing that's been around for probably about 20 years. I mean, essential oils have been around for a whole lot longer. However, people did not used to ingest essential oils. So we know that essential oils are very volatile. That's why when we put them in the diffuser, the beautiful scent goes out. We know that we get 100% effectiveness of essential oils when they are in the diffuser. A lot of people will put them on the skin. All right. Some people put them on the skin on a neat basis without a carrier oil, and that is a no-no, because what does that do? It disrupts the acid mantle of the skin, makes the skin more prone to invaders, and so we don't want to do that. The only essential oil that you can safely do that with is lavender oil. So just throw that out there. That wasn't in my notes, but apparently somebody needs to know that. What I was going to tell you is that it has become more and more in vogue for people to take essential oils internally, and we don't recommend that. If you are going to take essential oils internally, what you need to do is you need to get with a practitioner who is certified, who has insurance to cover any negative effect that happens from taking internally essential oils. Now, why do we say that? Because the essential oils are so volatile, and when it goes into the mouth, down to the gut, you've got from your mouth to your bottom is one continuous tube of mucus. That is your GI tract. Those essential oils go in there. They're highly caustic, and they can burn holes in the GI tract. When that happens, the mucous membrane it loses its integrity, and small little food particles are able to get out of that tube and get into the bloodstream. That sets up an autoimmune response. Why? Because the blood recognizes that these are proteins that are in here that are not supposed to be in here, and so that's going to set up an inflammatory response. If that is not checked, then that is going to cascade into an autoimmune reaction. So these are some of the things that we find here in the clinic with people that come in with psoriasis. I want to tell you, we had a guy come in and he had on long sleeve shirt, and it was in the middle of summer, and he was telling me that he had psoriasis, and okay. And I don't always ask to see because, as a woman, when my skin doesn't look pretty, don't look. Right? And so you don't want to ask people to expose things that maybe are uncomfortable for them. And so I didn't think too much about him having the long sleeve, and I've seen psoriasis, so I know what it looks like. However, he did, as we left in the appointment, he did pull up his sleeve, and on his arm was like white scales. They were milky white scales, and they were very thick. I mean, you could tell by looking at them that this was not just a flake or two or a spot or two. It was like he had body armor with this psoriasis. And so, of course, my heart just went out to him, because that can't be comfortable in Houston weather. It's been 110 and that kind of thing here this summer. That can't be comfortable to be walking around outside in the summer with those long sleeve shirts on, because you are concerned about your skin. But I want to tell you, within 3 weeks, those scales begin to fall off. And at 6 weeks, he still had some scarring on his skin, but every bit of that white, scaly substance had come off of the skin. Why is that? Because we had introduced good bacteria into the gut to take care of the bad bacteria and the fungal patterns that were not supposed to be in there. And so I'm just telling you, we've seen it where it's really, really, really bad. And within the 6 weeks, we've seen a miraculous improvement. And we're just so excited about that. All right. So if you have psoriasis, there is hope for you. All right. It does take 4 weeks for that old skin to slough off. However, you can help that. We don't want you picking at your skin. We don't want you damaging your skin at all. But there is this device. It is supposed to be for your face. This is a Lumi Spa. And we have these here at the clinic. We can get you a good deal on these. And I use this every day on my face. Why do I do that? Well, because number one, it massages my skin and it causes my skin to produce more collagen. All right. Why do I need collagen? I need collagen so that my skin stays plump, my skin stays supple, my skin doesn't sag, all those kind of good things. Okay. And I'm all about anti-aging medicine. I'm all about anti-aging devices. I'm just all about that. Why? Because I want to look as good as I can look, as long as I can look. And if there are things that we can do that help with the exfoliation of the skin, if there are things that we can help the skin to be its most healthy self, then we're going to do this. Now, this little device is not made for your body, but you can use it on your body. So if you have skin issues, you've got flaky skin, you've got crusty skin, you've got psoriasis, you've got eczema, you've got rosacea, anything like that, you can use this. It's oscillating heads. The little one goes one way, the darker one goes a different way. It makes just a slight little noise. Okay. Doesn't hurt at all. And I have seen people with psoriasis use it on those little areas, and it just helps exfoliate the skin. Because why? The skin overproduces and it doesn't slough off any faster, and so you get that buildup, which is what causes those scales. So this is a device that is a medical grade device. It is an anti-aging device, and I absolutely love it. And I'll just tell you how effective it is at anti-aging. Right? I was with a group of women last night that I've known for 10 years. And we were talking and just, having a good, just fellowship time, just talking and seeing how things were going. And one of the ladies asked me, we were talking about the Luma Spa. And one of the ladies asked me, and she said, have you had a facelift? And I said, no, not done anything. I take my collagen, I take my vitamins, and I do my Luma Spa all the time. Okay. So that's a great result when people who have known you for years and years and years, they can tell that there's a huge difference in your skin. So we love anti-aging and we love skincare. And so this is why we do all of this good stuff. Excessive exposure to UV rays will damage the collagen. All right, collagen does start to fade as we get past about 35. We start naturally producing less collagen. Now, there was a third-party independent testing that went on about collagens, and almost every collagen that was tested, and I don't know all the different brands that were tested, but the brands that were tested, the collagen was 12 to 14% bioavailable. Collagen is a real long molecule, and your body doesn't really know what to do with it when you take it in orally, when you take it in that way, because it's just a long molecule. When they tested the new skin collagen, they found that it was 49% bioavailable. The same third-party testing showed that when you use the Luma Spa with that collagen became 79% bioavailable. So really, if you're into anti-aging, if you want to, do all this, then we've got the tools that have been clinically proven to work. There is a lot of collagen out there that just does not work. So save your money and get the one that has been clinically proven to work. So we like that. We like that a lot. The sugar in your diet, as I mentioned earlier, also breaks down those collagen fibers. This is why you see people that have really poor diets, people that drink a lot, they have really bad skin. Why is that? Because alcohol turns to sugar. Sugar destroys the collagen fiber, so we don't want to do that, all right? It's funny because they call these molecules that the UV rays and the sugar produces, they call them advanced glycation end products, AGE. Okay, and so we're all about anti-aging, but these AGE molecules are caused from the UV lights and from the sugar consumption, so we don't want to do that. So there are also adipocytes. Okay, these are your fat cells in the skin. When you are having toxicity in the skin, when you're having your body's not able to clear itself and all that kind of stuff, then your skin is going to get, your fat cells are going to get bigger and bigger. Why is that? Because it is a body mechanism to keep the toxicity away from your visceral organs, okay? And so you want to make sure that you're keeping an eye on what's going on with your skin. So your skin will tell you a lot of things about your body. And so if we're carrying too much weight, it may not be because we don't exercise or eat properly. We may exercise and eat properly. However, if we have a toxic load that we can't get rid of, then we're going to have other issues because the body is naturally going to shunt that toxicity into those fat cells, and we're going to get bigger and bigger. So not fat shaming here. Don't want anybody to come away with that. It is a symptom of a toxic body. A toxic body will not have pretty skin. Your skin tells the story. All right. So your skin is able to determine touch, is able to determine pressure, is able to determine temperature, and is able to respond to chemicals via an ion channel in the skin nerve cells that are stimulated by high temperature and capsicum. Now, capsicum is what makes those peppers hot, those jalapeno peppers and those cayenne peppers that makes them really hot. So our skin has to function because it warms us and helps us in our environment. Skin color is determined not only by melanin production, but also by carotenoids and blood flow dynamics. Now, carotenoids, we've talked about carotenoids. What are carotenoids? Carotenoids are the chemicals in our fruits and vegetables that give them the beautiful color, the orange, the red, the green, the blue, the yellow, okay? Remember, we have our scanner, right, that measures the carotenoid activity in your skin. Why is that? Because if you don't have the ability to absorb the carotenoids, then you're not going to have the wherewithal to make antioxidants that stop the free radical damage. So if you are of a certain age, like my age, there used to be I think it was Jack LaLanne was his name. He was an exercise guy. He was a juicer. He had his own brand of juicing, but his skin was very, very orange. Now, why was that? Well, because he drank a lot of carrot juice, and those carotenoids colored his skin. So we don't want that. I'm not advocating that. I'm just giving you a present day example. And he lived to a very, very old age. I don't know. I don't think he's still alive, but he was alive for a very long time. Very fit, very muscular, and he was good. Okay, he was really good. So carotenoids are what you want to know. There are 30 different carotenoids in our fruits and vegetables. The more you eat, the better your skin is going to look. Dietitians recommend that we have 30 different fruits and vegetables every week. Now, I don't know about you, but I fall way short of that. We do have fruit, we do have vegetables. We do make that a, priority in our meal plan. However, I don't think I come real close to 30 different ones per week. So I take a really good vitamin that has a lot of carotenoids in it to help make up the shortfall there, all right? Again, UV light from the sun can cause oxidative stress to the skin. The carotenoids in the skin are particularly adept at protecting the skin through this kind of damage. So make sure that you eat properly. Make sure that you're not in the sun without protection. Now, this is very interesting, and so I'm going to leave you with this because we're all going to be looking at each other's skin now, right? We're going to be doing that. So specific skin color can indicate disease and sometimes very serious disease. So a pale skin, known medical term is pallor, can be indicative of reduced blood flow, maybe Raynaud's syndrome, or a reduced number of red blood cells as occurs with anemia. So if somebody tells you that you're pale, you want to think about maybe I don't have enough red blood cells, maybe I'm anemic, maybe I'm tired all the time, and that's just a real easy fix. If you have blue skin, or cyanosis is the medical term for that, it can be caused by an overabundance of deoxygenated hemoglobin in the blood. It is a symptom of severe heart or lung disease. So if you see somebody that has a tinge of blue in their skin, you want to refer them to a cardiologist to get a check. They may not be, they don't have oxygenated blood. They may be having a bad heart issue, and we want to catch that before they have a full-blown cardiovascular event. Yellow skin. Now we see this a lot. You will see this a lot. Yellow skin is indicative of jaundice caused by liver issues. Now, this can be a stagnant liver. This can be a congested liver, okay? Or it can be more serious to be liver cancer, or it can just be a viral infection such as hepatitis, all right? So we want to make sure when we look at people and their skin is a little off, then we want to make sure that we take care of that and we refer them to the appropriate medical person so that we help them to stay healthy, okay? Your skin tells a lot about you, okay? And finally, If you have areas of skin cancer that are abnormal in color, you may be dealing with melanoma, which is a skin cancer. Now, not every spot, not every mole, not every skin thing is indicative of cancer, but we want to pay attention to that, and we want to make sure that we go to the dermatologist regularly, have them do a whole body scan to see if there's anything that looks funny, looks suspicious, because if you catch it fast, then you can deal with a lot of the things. So you have learned a lot of things today about the skin and how to keep the skin healthy, how to eat right, how to supplement properly, and how to encourage your skin to produce more collagen, to produce, to exfoliate better so that your skin always looks as pretty as it can. If your skin is not pretty, it is indicative of what's going on the inside. Okay, that is the main takeaway. When your insides are pretty, your skin is pretty. So don't just look at it from a vanity point. Okay, and a lot of people in our area, we're very, very Christian, and we know that vanity is one of the 7 deadly sins. Okay, so we're not advocating that, but we are advocating knowledge is power. Pay attention to the way your skin looks, because if your skin isn't looking good, there's something going on the inside, and we can help your body do what it needs to do to reverse all of those conditions. So until I see you next time, have a great weekend. Take care of yourself. Do a lot of self-care, and stay out of the sun without SPF, and do what you need to do to increase the production of collagen. Get your skin so it is healthy, it repairs itself, and it's your little earth suit, and you want it to look as good as it can. So I will see you next week, and take care and have a great weekend.